It's time for the Half Hour to Health with Dr. Bob and Debbie DeMaria. Call a friend or family member now and let them benefit from today's exciting and informative program. If you want to lead a healthier life, the time is now.
Welcome to our Half Hour to Health. I am Kason DeMaria and I'm joining Anthony and Bob DeMaria, and we are here to talk about your nervous system. I bet you didn't know that your nervous system controls your entire body. So just going back to where it starts is your brain sits in your skull and it travels down as the spinal cord. The spinal cord is protected by the column. Within the column there are these small holes and they exit all of your nerves to all of your vital organs. So if you have any type of shift or what we call a subluxation in your spine, that compresses the nerve energy that goes to the rest of your body. So I know today that we are going to be talking about how your forward head posture can apply extra pressure on that spinal cord. Dr. Anthony.
Yeah, so that is definitely one of the bigger issues that are coming up nowadays. And, you know, I was doing some traveling recently, and just about everybody that I saw, what ended up happening is their heads are down and they're doing this on their phones. And they're doing this, not just a few of this, it's just keep on doing. And then, you know, I don't think what you realize is when your head is forward in that position, it's putting a stress on your spinal cord. So I was recently listening to a radio program and they're talking about since they got their smartphone that their eyesight's gotten worse, and they wanted an ophthalmologist to call into the show to talk about it. And I wanted to call in and say, listen, your eyes are a direct reflection of your nervous system. So if your head is always in a forward position because you're doing this motion or this motion and you're not working on bringing that backwards, you're going to result with dysfunction or lack of optimal performance. So one of the things and why it's so important is this is going to represent your head. So your head weighs anywhere between 12 and 15 pounds depending on the size of your body. So if you were to look at your head here from the side, if it's coming forward from the rest of your body, what ends up happening is that's putting extra pressure on your nervous system. So within your spinal cord and your neck, there's a nice C curve in there because all the structures in nature that are arcs are the strongest ones. So that's no mistake that there's one there in your neck helping your spinal cord function to the rest of your body. So what ends up happening is when your head comes forward, it's going to stretch your spinal cord, and the nerves that are coming from the spinal cord aren't able to function like they were intended to. So one of the things that I'm particularly passionate about is educating people about their heads coming forward and the misalignments of their spine that are causing that to happen. So one of the most frequent conversations that I have with people is showing them their posture and saying, we need to make a change here, because if we change how your cervical curve is and the relation of your head to your shoulders, it's going to change how your body functions. So just like Dr. Kason was talking, the brain and then the spinal cord and then the nerves to the body, it is the master control system. It's like the circuit breaker of your house. If the circuit were to go off to your refrigerator, what would happen to the food that's inside? And yes, I know all of you that are on your couch just said that it would spoil, and you guys are so smart because that's exactly what would happen. So it's the same principle that applies inside your body. If those nerves that go to your heart and lungs are off, you might have some breathing challenges or asthma. So one of the things that's really great was when people come and see us, we're able to educate them on how the body works and what's going on inside of their body. And they get a grasp on what's going on with them physically, chemically, and emotionally, and we're able to affect their overall well-being.
I could put that right here if you want. Okay, so I'll tell you what's really is fascinating and intriguing is the nervous system controls everything. And I think that somewhere along the line in our training of individuals, the whole mindset is that healing comes from the outside in, and it is just the opposite. healing comes from the inside out. So when God created us and he breathed life into Adam, Adam had natural healing abilities inside of his body that's been passed on to us from generation to generation. Now I'm going to share a story with you. It's a true story because all of my stories are true, and how in nature we are no different than what goes on in nature. So when there was several years ago, our neighbor had a tree that was an ice storm, and this particular branch that was connected to the tree broke and it became disconnected. And over time, barnacles started to grow on the branch. So what I did after the branch fell off the tree is I cut the two ends off because I knew this would be a great visual for everybody. So in the human body, as Dr. Anthony and Dr. Kaysen have been so eloquently telling you, is that these nerves come off the spinal cord. The spinal cord, which you have 31 pairs, send messages to the rest of the body. So when this part of the branch became disconnected from the tree, it lost life. So in nature, this is so important. I pray that you can wrap your brain around what I'm going to share with you right now. In nature, nature sent organisms to eat, or parasites, or whatever you want to call them, or barnacles, to eat the material on the branch to go back into the ground to be recycled. So it is very logically possible that if your nervous system is not sending the messages, I almost want you to think of your heart right now, or your liver, your gallbladder, if you're having dysfunction, is no different than this branch not functioning at 100%. Now this particular neighbor was a very eccentric human being. And what he did, do not even ask me why he did this for, and I was this close to doing it myself because I thought he's old and wise. He had somebody come over and drill holes into the ground and put fertilizer into the ground for the tree. Well, within 3 years, for some reason the Lord said, don't do that, don't do that. Within 3 years, that tree started to die. He started to die because he altered the physiology the way God set it up to be, is that nutrients go to the surface and they trickle down. So that person's body was just over, there's too many chemicals. Probably a lot of times when you are taking different various medications, you're over chemicalizing your body. Don't want to go there, but bad effects happen when you cannot fool Mother Nature.
And that's really one of the things that's so smart about how our bodies work, and I know that we've talked about before, is gravity never takes a vacation. That's why it's so important to have the correct posture of your spine. On top of that, we've talked about the temperature that water freezes at or boils at. Those are natural principles that take place out every day in the real world. So what we do is we're applying the principles of life and health inside of your body, and when we apply those and your body heals itself like it was intended to, people get better. So a lot of times someone might come to us and they'll say, well, hey, Dr. Bob, Dr. Kaysen, or Dr. Anthony, what you guys did to me changed my life. And a lot of times our response to them is, you know, we'll thank them for what they had to say, but it's really what's going on inside of you that made all the difference. We were just God blessed to be able to have the training to be able to impart that knowledge onto you. So I know that one of the things that we've learned along the way too is how something like a banana could impact some of our patients. So there's one of the common conversations that I have with the patient on a regular basis is how something like a banana affects what's going on the inside.
It's funny, when you ask people, do you eat bananas or yogurt or ice cream or pineapple or berries? They say, yes, I love bananas, I love yogurt. I eat those every morning for breakfast, and they're proud about it too. But what we're finding is that people who eat bananas especially have left neck and left mid-back pain, especially when we're in the examination and we're looking at their range of motion, how far they can turn their head to the right and to the left. So many people are not able to turn their head to the left properly because of what they're eating and the sugar they're putting in their bodies. The reason that is because your pancreas, which digests the sugar in your body, refers to the left shoulder and left mid-back. So when you start educating people about what they're putting in their bodies and small changes that they can make, like instead of eating a banana, eating an apple, they'll come in, you know, just from doing that for 1 week, not eating bananas. Wow, my left shoulder and left neck feel much better, and I can actually turn my head in the car when I'm backing out of the driveway.
You know, I kind of chuckle when I hear that story, because it was by the grace of God. It was in 1987 when I was driving along the road. You know, I was just like, Lord, I have all these people with left neck and mid-back pain. Tell me the answer. I felt like I was Joshua out in the wilderness, and the Lord said, it's the sugar. So then I happened to start on Christian radio, and I used to say very bold statements. I actually got some negative feedback about this, but you know what? I'm a little bit older now, a little bit more mature. I used to say that sugar was from the devil, and Christians didn't like that, especially when they're going to school, and the kids were saying, Mom, did you hear what Dr. Bob said? I mean, I've had people call me up and said, can you stop saying sugar's from the devil? Because our light was shining on their darkness. But this whole sugar thing, what we are blessed to learn is that the pancreas, which exactly what Dr. Kaysen said. So I'm gonna take you back here. It was in 1974. Some of your parents weren't even born yet. I was in chiropractic college. I was taking an embryology class, and the doctor was explaining about how the body developed, and it was one of those epiphany moments for me that I didn't even realize it was the epiphany until 20 years later. The pancreas originates in your upper left neck and mid-back embryologically, and it twists over to here into your abdomen. So I started having patients come into our office because, now listen, this is so profound, and this is one of the reasons that we write books, because you're not going to hear it anywhere else, is that vertebra will move because it's called, a big word, a visceral somatic subluxation. So your pancreas is overworked because you're eating all the sugar. It sends a message back up to the vertebra, literally shutting it off so it won't be overstimulated. And people will come into our office and we can see an x-ray pattern of vertebra going to the left, to the right, to the left, to the right. And then what Dr. Kaysen says, we might say to you, hey, have you been eating bananas or raisins or grapes or sugar? And they'll go, yeah, how'd you know? Well, because everybody in America eats bananas, raisins, and grapes. Do you know that yogurt has more sugar in it than ice cream? Well, it causes this chronic left neck and mid-back pain. So we don't promote yogurt. And you can email us. That's okay. You can say, well, Dr. Bob, where do you get your calcium from? We're going to take a short break, and we'll be right back, and we're going to tell you. Hello, this is Dr. Bob, Anthony, and Kaysen DeMaria, and I'd like to invite you to join us at our office. We are here to make a difference in your life. We will listen to you. We will listen to every complaint you have and help you make wise choices for your long-term health problems.
I just want to invite everyone to bring their kids into our office because we have so much fun and we know how we can make a difference in impacting not only the kids but also your family, just helping them reach that optimal level of function.
And one of the things that we're blessed to use is some advanced technology with how we go about your care. So we're able to do special thermal imaging of your spine and do motion x-rays, and we're also just able to use some biocommunication devices in order to figure out the best plan of care for your specific case.
So what's going on in our particular practice is that we have high-end technology. We've been skilled, trained, and experienced. We will listen to you. We know that you want wellness. We look at the whole package. We look at the whole person, regardless of whatever you've had done to this point, whether it be surgery, you're on medications. Give us an opportunity to serve you. We have taken care of this area for over 35 years, and we have the expertise to make a difference for you and your family. We have educational material that's available to you. We have material that's available in the form of books and technology. So we'd encourage you, regardless of what you have going on, that you give our office a call today. Let us make a difference for you and your family. And we're also available to speak at your business, your organization, or your church. We love treating families. We love chronic problems. Give us a call today. You'll be glad you did. Hello, this is Dr. Bob, Anthony, and Case and DeMaria. Welcome you once again to our Half Off Health program. And this is what we've learned. Sugar irritates the pancreas. The pancreas secretes enzymes. And the reason that dairy and sugar bother the pancreas is that there's an enzyme called lipase and protease. Well, lipase has to do with fat metabolism. So I wanted to throw that out to you. So you say, well, Dr. Bob, if I don't consume yogurt, where do I get my calcium from? So I'm going to ask you a question. When was the last time you saw a cow eating cottage cheese, milk, or ice cream? You say, Dr. Bob, you're being silly. I'm not being silly. I'm just telling you, I'm asking you a question. They eat hay, grass, and alfalfa. Now, I'm not telling you to eat hay, grass, and alfalfa. Kale, greens, spinach, sauteed and cooked, broccoli, cabbage, cauliflower, sesame seeds, almonds, all great sources of calcium. Before I flip this over to Dr. Anthony, I'm going to share one other concept with you. When somebody comes into our office and we take films of their spine, there's a large blood vessel in your abdomen called the aorta. It's a test question, by the way. It takes 40% change of the lining of the aorta to show up on an x-ray. You say, Dr. Bob, where are you going at with this? We have had patients come into our office that we have seen aneurysms on their x-ray, and we've seen calcified aortas, and the very first question I ask each and every one of them is, do you eat ice cream? And they look at me like, yeah, how'd you know? Hello, ice cream causes inflammation. So if ice cream causes inflammation in your aorta, it causes inflammation in your heart, inflammation in your brain. So we're just trying to help you. You can see one of the positive aspects about you making that wise choice to come to see us is we will get to the root cause of your problem. Dr. Anthony.
So one of the things that's important, and we've been talking about a little bit, is how your brain communicates with your body through your nervous system, and how through chiropractic we impact how your nervous system functions and your body gets better. So we have this particular patient that we've been using some technology on, and we've been using our thermography scanning her every time that she's been in the office, because it's a way that we can monitor how her nervous system functions between each visit. So our goal would be that her nervous system is changing and getting better. So we've been doing great progress. She's been getting adjusted once or twice a week, and we're making appropriate and necessary lifestyle changes with her, and she was happy. And then what ended up happening was there was a recent holiday, and over that recent holiday she deviated from what she was doing in the office. And then the next visit came up, and we took the thermal scan of her spine, and it looked completely different than the scan that we had before and how good it looked. And I turned my head to this individual and I said, did you possibly make some alterations to what you were doing over this last little break for this holiday? And she said, well, yes, I did. And how did you know that? And I said, well, because your body doesn't lie, and it has impacted your nervous system and your body's ability to heal itself, because we have the scan that's right there in front of her, and her eyes became as big as they could ever be. And she was definitely a believer to understand what we put into our bodies affect how our brain communicates with the rest of our body. So it was just one of those tools that we were able to show her and our patients that what we put into our body affects our brain's ability to heal itself, and our body's ability to fight off what's going on, and the nervous system's ability to work at 100%. So I know that, you know, it doesn't just apply to her, it can apply to kids or adults. So one of the things that myself and Dr. Kaysen and Dr. Bob are passionate about are treating families and kids. Because when families and kids get the big idea, we can impact generations. So we've had some great experiences with kids, and, you know, a lot of times what ends up happening, it has to start with a shift in how the parents think about what's going on with their kids.
Yes, and also sometimes when people think about kids getting adjusted, they get concerned like, oh my gosh, the baby's going to get adjusted. But what's amazing about kids is their adjustment is so gentle because their spines are completely different than adults. So what we look at in a pediatric patient or a child is completely different than what we look at in an adult because of how their spines are forming. The best time for someone to get checked is when they're pregnant, because if you think about what you're putting into your body and what's going into your body, you want to think about pre-birth. So that's a big concept for people to think that pregnancy can, you know, getting adjusted during pregnancy can benefit your delivery time, but also how the baby's nervous system is functioning. But something that just recently happened in our office was two parents brought in a child that they said that nothing was going on with the baby. The baby had a natural birth, everything was okay, the baby was going to the bathroom. She did have some colic, but that had subsided and she seemed like a great baby. After the baby's first adjustment, we also see the baby's grandparents, and the grandparents came in the next week saying, I don't know what you did to our granddaughter, but she's sleeping, she's going to the bathroom, she doesn't have her digestive problems, she's been great. So that's just something that just happened to us in the past week, that sometimes the parents don't always tell us what's going on with the baby because they think that it's normal, just normal expressions of what's going on in the child.
So it's interesting that you say that too, because when it comes to a baby and their nervous system and how we look at a baby is different than the principles that we would look at in an adult. So like we talked about at the very beginning of the segment with the bowling ball and your head coming forward. Well, I'm sorry, I don't see too many 3-month-olds that are in their crib hitting on the text message. So there's a completely different set of circumstances that are going on with children. So that's one of the things as we do is we're educating how the baby's spine and nervous system is forming and how what we're doing is impacting their innate ability to heal and have optimum performance that's in there. So one of the things that is important for ourselves is you should see, if you think that birth is anything but natural, when it comes out, there is pulling and twisting, and that process creates trauma to the baby's spine, and that results in what we would call a subluxation or an interferences to the brain's ability to communicate with the body. So one of our questions to you is, when would it be appropriate to get the baby checked? And you might be scratching your head right now. Well, that's a good question, Dr. Anthony. Well, if you were in our family, we would say as soon as the baby's born because of what had happened. But would you want to wait for 1 symptom to show up, 2 symptoms to show up, 3 symptoms to show up? Maybe they stop pooping. Maybe they're not feeding correctly. When all of those things are going on, when symptoms are showing up that you might think are normal, that's a baby's way of saying, hey, mom and dad, something's not right here on the inside. I don't know how to tell you because I can't talk or text yet. So I'm trying to let you know that I might have a subluxation in my spine and you should take me to the chiropractor. So wouldn't that be great if all babies did that? But that's just how we would look at something a little different when it comes to educating parents with small children, why they should bring their kids into the office, because a lot of times those adjustments that are small and gentle make a big lasting impact on that child's life for their entire life because they got checked by a chiropractor when they were young.
I'll tell you, that was really good. And if you're a parent right now, and you have a child, and we've had guests on the program before, and I had one particular family that the baby was at 10 months old, started the whole antibiotic, and in those 8 months, that child was on perpetual antibiotics. And this is another true story. They took the baby to their pediatrician and said, we've had enough, we're going to do something natural. And the pediatrician said, you're going back to the horse and buggy days. And this person watched us on TV, came to the office, drove 1 hour, and we did an assessment, started to do spinal